Hey, this is Dr. B, and this is an introduction to medicinal chemistry. We'll talk about medicines and how they interact with the human body, two classic traditional medicines, including aspirin and penicillin, opiates, including things like cocaine and heroin, how drugs interact with your stomach, antivirals, including COVID-19. This is videotaped in 2020, so very relevant. Drugs in the environment, Taxol, which is an anti-cancer medication, nuclear medicine, and the actual drug making process, and we'll finish up with some classical identification and purification techniques for medicines. All right, introduction to medicines. Before 1900, most medicines were natural product based, meaning that they were isolated from a natural product source, plant or an animal, oftentimes a plant, or they might just be a concoction. Rather than an individual substance, they were an extract. Most drugs are now synthetic, and here's a typical synthetic procedure. This one happens to take place with retention of chiral centers, which can be a challenging thing to do. The term drugs is often used synonymously with medicines, but the term drugs may mean something that's non-therapeutic, especially in sort of street use. Here's a analysis of drugs in terms of how they administered and whether they are generic or still on patent. A patent typically lasts for a generation or so worldwide. Once they go off patent, they become generic. The price typically goes way down at that point. In terms of delivery, there are various places to which the drug might be delivered. By far the most popular method is oral, which typically means a pill. It might be inhaled through the mouth. It might be introduced nasally as a drop or a spray. You might have drops that go directly into the eyes. You might have ear drops. You might have topical or transdermal applications, meaning it goes right through the skin. It could be administered rectally or vaginally in the form of suppositories, creams, foams, and sponges. And another very popular method is to introduce the medicine through an injection. Now, you might jam it through your skin and go right into the muscle, which is the deepest. If you pop it less deep, you can go subcutaneously. The one you're probably most familiar with is intravenously or IV, which requires some skill and means that you have to find a vein and inject it that way. So it can go directly into the bloodstream, or you might just pop it under the skin very shallowly, and that is intradermally. This is a brief introduction